Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today, the topic has to do with the observation of International Biomedical Laboratory Science Day, which has as its theme the guardian of quality and patient safety. That is such a very big responsibility that the medical laboratory scientists carry. And so my topic is patient contribution to wrong lab results. The role of the medical laboratory scientist is to be clever, and one of the ways of being clever was itemized by one of the speakers, Noye Umaye, when she said that should a patient bring the wrong sample in the sample bottle, that the sample should be collected, that bottle should be collected from that patient. Because if you allow the patient to go with that same sample, giving the patient the right bottle for collection, the patient will go, and what the patient will do is to decant whatever was in the former bottle and then return it back. So the result you are going to get can never be a reflection of what is wrong with the patient, and so the safety of the patient is not taken into consideration as far as the I won't call it negligence of the laboratory scientist is concerned, but that area you find that very handy if you've not experienced it before, but this information becomes very useful. So I am now going to expatiate more on what the patients, you as a patient, could do to get a wrong laboratory result from even a very competent laboratory that is standardized, that meets the international standards, and that is what you must look out for. So if you like my presentation, like I always say, press the like button, subscribe, and let's move on into the nitty-gritty of the topic.
The objective is to let the patient know that their destiny is in their own hands, so that they may keep abreast of the developments in the medical laboratory, follow instructions for quality results, and the assurance of their safety. The introduction. The International Biomedical Laboratory Science Day is a yearly event fixed for the 15th of April. The theme this year is very germane: guidance of quality and patient safety, biomedical laboratory scientists. That is not in doubt that when you are able to give quality service, you are not only giving your service as expected, but you are also guiding, at least ensuring the safety of the patient. That is the relevance of your results in the management of the patient's health. Quality standard laboratory practice ensures patient safety. Patients are very much involved in pre-analytical errors, and it is therefore necessary for these errors to be exposed for precautionary measures to be taken by them and even the laboratory scientists, and also for the cooperation of would-be patients. The method I shall use to address these problems is to list them as cases. Case 1, for example, is food injection. You find people eating before certain tests, before doing laboratory tests. This increases the glucose level, insulin level, gastrin level, triglyceride level, sodium level, uric acid level, iron level, healthy lactic dehydrogenase level, calcium level. It also decreases the chloride, phosphate, and potassium level. But if we have to go for these kind of tests, we must be ensured that we do not eat where it is not necessary to eat. There is also the fasting that is required for fasting glucose tests, triglyceride, and lipid profile tests. When we talk of diurnal variation, we are talking of the result that you could get in the morning or afternoon. So increase in the morning, you find values of ACTH, cortisol, iron are increasing, and you can get lower, a parasite, if you are examining for it around the 10 a.m., 2 p.m. period. The same thing for evening samples. That is, you find the growth hormones increasing, PTA, TSH, and then Bushera bankruptcy, a parasite, the microfilaria parasite, you can get it around 8 p.m. You find when patients take alcohol, like somebody taking alcohol in the morning and going for a test, this decreases the glucose and increases the triglyceride. If you put yourself under unnecessary stress, then you are increasing your ACT level, the cortisol level, and catecholamines level. When you do strenuous exercise, you are increasing your potassium level and phosphate level, lactic acid level, CK, creatinine kinase, AST, lactic dehydrogenase, and protein level. Your posture, if you are standing, it increases albumin, cholesterol, calcium, especially when you are standing and they are collecting your blood for laboratory examination. Another very interesting case is urine connection. If a patient is asked to bring his urine, it could be for urinalysis, and it is therefore necessary to prevent dehydration as it affects urine both microscopically and microscopically. When you are dehydrated, your urine tends to show so many crystals, and the color becomes dark, amber, and what have you, whereas these are more or less indicative of other things that if you normally bring a sample when you are hydrated. The urine part is also needed, maybe midstream urine, where you take the middle part of the stream, urinating the first part away and then collecting it for culture. Early morning urine, that is the first urine you produce in the morning, usually for pregnancy tests and others. Then the terminal urine, where you are examining for schistosome, because the schistosome hematobium especially is resident in the bladder, where it produces its little ones, the ova, the eggs. That case 4 is the reception. The reception is where the patient really meets the laboratory personnel, and it is therefore a very important place for the patient to assess the quality of what the kind of result that will come out from such a place, because garbage in, garbage out, if the right quality of sample is not collected. So you look at the reception, whether there is the wearing of protective gear, lab coat, gloves, face masks when necessary, and then the physical cue, the appearance of the receptions are all part of the quality assurance that the patient would need. So a reception like this looks very beautiful, but mind you, the laboratory scientist that is at the reception or the laboratory personnel is looking more like a clerical staff that just want to write or enter certain important data and not ready for samples collection, because the patient will bring samples and he is supposed to put on his lab coat, protective gear, gloves, and what have you. But let's take this as yes, there is nothing wrong with patients familiarizing themselves with sample bottles, which I had treated. You can look at my old videos on sample, and you can see to differentiate these samples because they contain different chemicals. Some of them are plain, they have no chemicals. So the color of their lids is used to differentiate, because what you may need may not necessarily be available when you do not use the right sample bottle, and therefore what you are estimating is not there. So to claim that the values or the parameter is low is because you are doing a wrong test. So it's advisable for patient to be familiar they are very familiar with the color of the bottles that they are taking, and they insist that that is what they would collect for the collection of that sample. Yeah, timeliness is very important. You have many samples are supposed to be analyzed within 2 hours, some within 1 hour, especially the enzyme test and hormonal samples. They are very sensitive. And there is also the time of production of semen samples, which must be indicated on the bottle to aid the quality of the result. So, wherever time is stated on the bottle, you must make sure that the bottle is correctly filled, and that is part of quality assurance. Yes, wrong labeling. That is one important aspect that could derail everything, all the quality of work you have done. The labeling must match. The name on the bottle, the sample bottle, and the name on the form must be the same. You don't say because you bear so many names, then you decide to use another name, and then the name on that bottle is now different from the name on the form. So patients must ensure that whatever name they bear, the information they are putting in, they fill all the vacant labels, that is information necessary on the sample bottle, and also they must ensure that the expiry date of that bottle, if it's a sterile bottle, is noted, because if the bottle has expired and you are putting your sample in it, the guarantee, the quality of that result is not assured. You are already using a bottle that could contain extraneous organisms that may not be reflecting that which is in you. So these are areas where one must make sure that it tallies. Yes, hemolysis is a different kettle of fish altogether. This is when you cannot really have the different parts that is stated. Blood components. Blood itself has three major components: the plasma region, the buffy coat, and the red blood cells. So you can see, as this label, the content of those areas. So you can see in the plasma, you could estimate for protein, collect that sample there. And if you want to look for the red blood cells and what have you, you know that you have to spin and concentrate. So this is the beauty of the laboratory test. But when in the process of collection you stiffen your body and everything, there is hemolysis, then this test is quality not assured. There is no assurance that what they are testing for is exactly what is there. So the patients must cooperate so that the sample collected will be very easily collected, and what is to be estimated is exactly what is being estimated, or else the hemolysis, even if it's a medical laboratory scientist of repute and sees that there is slight hemolysis, he will reject the sample. So the patient must understand that with all the pains that we stood, the blood could still be rejected because of hemolysis. So there is that necessary, the need for serious cooperation. Number 9, we'll be talking about medication. Some medications affect the result of laboratory tests, especially if you are taking antibiotics and all the other drugs. It could affect the protein estimation. So if the protein is to be estimated, we are sure that you will not be getting the right values, the right concentration. And the management of such a patient is not perfect anymore. The results are not relevant. There is no assurance of quality. So medication at times, if you are to be tested, you need to inform the medical laboratory scientist the medication you have just taken or you've been taking, before the test is done, so that they can factor it. If there is going to be a need for you to stay off the drug for the period before the test is done, yes, that will be recommended.
By way of conclusion, you will agree with me that the patient play a major role, because once your sample is wrong, like I've always said, garbage in, garbage out. It is what you have brought that is going to be reflected. If you ask somebody, for example, to bring his or her urine, and the patient went and brought a male's urine, there is no way the medical laboratory scientists can know. But garbage in, garbage out. So the pregnancy, even if it's in the patient that brought the sample, will not be detected. So the patient plays the most important role in getting the best of result. And on that conclusion, we stand to educate ourselves more, that we should be very vigilant as patients to know more about the test. And where you are confused, ask for the medical laboratory scientists around, so that your problem can be put, or your fears especially, can be put to rest. Check more of my videos in this channel.